Hello, I'm going to show you one of my favorite exercises to really help that range of motion around the SI joint as well as around the sacrum. It's very common that patients carry a lot of tension here from sitting, from standing, from working out. Maybe there is a weight issue kind of going on from an imbalance due to a posterior pelvic tilt or positioning of maybe you'd like to just be more in an anterior pelvic tilt. So this exercise is fantastic. To do this, you will need most likely a yoga block. That's ideal and the easiest form. You also, maybe if you don't have that at home, you can just roll up a towel and have something that has a little bit of height to it, because that's really what we need to do this exercise properly, okay? So you're going to place the you're gonna place the yoga block. You're gonna have one knee on the yoga block. And from there, you're gonna take the opposite knee that's down. I'm gonna actually show you on the opposite side. So just placing that yoga block down, I like to protect the wrist. So we're gonna go onto our knuckles. And then from here, as that weight is unevenly distributed, we're gonna push the knee into the hip. So we're not lifting the hip up for this exercise, we're pushing the knee into the hip. So you're just gonna focus on creating a little bit of mobility, almost getting a little bit of a stretch, kind of like right here above our sacrum area. And you're gonna do that most likely on both sides, just because it's a lot easier to make sure that we are doing on both sides, even if you are only having pain on one side. And you might not feel anything at all when you do this exercise. Maybe if you're extremely tight, you're like, wow, this is giving me so much relief, and that's really good and awesome. And that's how you know you need it. But if this exercise was recommended for you to do, I recommend doing it regardless if you feel it or not, or ask me or your doctor if you're doing it correctly if you're not feeling it, okay?